Great. Thank you. Thank you, sir. Thank you to the team for having me as well. I am going to share my screen. Just allow me a minute. But as I do that, I think just a quick background about me as well. As Vikram sir mentioned, I've been with NHA um, for over a year now, working very closely with Vikram Pagaria sir's team and working on integration and adoption of ABDM. So how, as I understand, majority of the participants here are folks from hospitals, various physicians as well, who want to understand more about ABDM and how they can join the ecosystem. So keeping that in mind, I've divided the presentation broadly in two bits. One is, I think, just a quick understanding of what ABDM really is, right? Bust any myths, questions that there may be about ABDM, its architecture, and how this ecosystem is really evolving. And the second bit is actually how can everybody join the ecosystem? So for everyone who is present here, again, whether they're a practicing physician or they have their own HMIS or so on and so forth, how can they integrate their platforms with the ABDM ecosystem and really join the journey on digitizing healthcare in the country, right? Bharat sir, I don't know how we're doing. Should we take questions at the end or should we open question in the middle as well? However you suggest we can.
Take it at the end after the
Sure,
presentation.
sure, right. Yeah, so just a quick background about ABDM, right? I mean, I think ABDM, erstwhile NDHM, right? National Digital Health Mission, it was called a couple of years ago, was envisaged really to build a digital health ecosystem that supports universal health coverage in the country. And this was grounded very, very solidly in technological and policy principles, right? So can we build single source of truths in digital healthcare? Can we have an infrastructure that in healthcare that is a federated architecture? So there's ensuring that there is confidentiality, security, privacy of data as well. Can we build an ecosystem that is based on open APIs and enables interoperability? So those are bits from a technology side. And from a policy standpoint, we've kept the ecosystem as user inclusive as possible. We want people from every corner of the country, every start of the society to be able to participate in the ecosystem. So it's very user inclusive. It's voluntary in participation as of today. We want people to be aware of ABDM themselves and join the ecosystem and leverage the benefits of it. And lastly, I think the intention really is that can we move towards an ecosystem that is more wellness centric? So can we move away from reactive care to actually preventive care, and how can ABDM really support this vision at large? So this is just a quick journey of how ABDM has evolved. So it actually, the thinking behind it started pretty much from 2017, where there was a document on national health policy that came out. Then we had the national health stack that came out in 2018, and then the national digital health blueprint that came out in 2019. These papers came out, from NITI Aayog, from the Ministry of Health and Family Welfare themselves, culminating in the NDHB, the National Digital Health Blueprint, as we call it, with support of NHA. That really becomes our Bible on what the ABDM ecosystem is really built on. And all of these documents are available on public domain. So would definitely encourage everyone to do go through these documentations if you'd love to know the more details and nuances of the ABDM ecosystem at large. And I think post that, in 2020, the Honorable PM announced this as a pilot across 6 UTs. And for a year, a pilot was ran to actually understand the on-ground implementation and learnings, post which in 2021, it was launched nationwide for all states and UTs, for all healthcare practitioners, all health tech players, and all citizens to actually now join the ecosystem. In Feb 2022, happy to report that it was approved as a central scheme. And in September 2022, we actually finished a whole year, and we had a great event actually to commemorate the work that had been done in the first year itself. And as of today, where we stand, we're really focusing on, okay, it's been live for over a year. How do we really drive its adoption in the long run? Now, what is ABDM, right? That is the key question that comes up very often. So before I get into the more technical, complicated slides, I just wanted to spend a minute on this, right? Just simplifying the concept. I think there are 4 key objectives that ABDM is trying to solve for by building the tech infrastructure the digital infrastructure that is required to support digital healthcare in the country. So first of that is to build digital identities. So can we build digital identities of all actors who are in the healthcare ecosystem? So right from your citizens to healthcare facilities, healthcare professionals, as well as drugs. So can we build authenticated, verifiable identities for all of these actors in the ecosystem? So that is one aspect. Second is enabling interoperability and exchange of health data. So ABDM architecture allows for interoperability, meaning exchange of health data across various healthcare facilities, healthcare practitioners, to exchange data from one healthcare provider to another healthcare provider. So today, sharing data between two different hospitals becomes very, very difficult. We're carrying usually physical files, copies of our reports to share data. But through this architecture, it'll be possible to digitally exchange data across various stakeholders in the ecosystem. Third is the interoperability of health services. So how can we make services more accessible, more interoperable across various platforms? These services could include teleconsultation, booking physical appointments as well, discovering drugs, booking ambulances, discovering blood banks. So anything to do with health services, right? How do we really make those interoperability in the services aspect is what ABDM also enables for. And lastly is interoperability of health claims exchange, meaning, how can we standardize the claims process between a hospital and a provider and a payer, an insurance company, and how can we standardize that process? Right. So just to recap, how can we build identities? How can we better exchange health data? How can we better enable interoperability of health services? And then the insurance piece. So largely, if you'll see, the entire journey of a citizen is really covered for, right from discovering a service to exchange of health data and then also filing for claims. So all of these aspects is what ABDM enables for. And the idea is really to that it will increase accessibility, efficiency, and transparency in the healthcare ecosystem. Now, the thing is that there are many, many challenges that currently everybody faces. For a citizen, it could be, can I check my medical records at one place? I'm getting services from many, many different hospitals or providers. Can I have all of that stored in one place? Can I share my health record data with my doctor with ease? Can I book health services? Can I order healthcare products online? Right. So all of these challenges that a citizen currently faces can be addressed by the ABDM ecosystem. And similarly, for a healthcare provider, it enables them to access and view a citizen's health history. It also enables them to participate more actively in teleconsultation. And then from a policy standpoint, can we, at some point also think about how can we make data available at a national level, which is aggregated, anonymized, and that can really support decision-making and policy-making at a state or a central level. Now, I'll pause here for a second because I think this slide really encapsulates what ABDM is in a nutshell, right? So I think if you can just follow my cursor, if you can see that moving. This is the bottom layer, right? These are registries that I spoke of earlier as building identities. So ABHA, the Ayushman Bharat Health Account, which is an identity number for all citizens in the country. Healthcare Professionals Registry, which is a registry of all healthcare professionals in the country. Healthcare Facilities Registry, which is a registry of all healthcare facilities in the country, and Drugs Registry, a registry for all drugs in the country. So these 4 registries are being built under ABDM as digital public goods. So essentially, it will provide identity to all of these various actors in the ecosystem, as I spoke of. And interestingly enough, these are being built on top of some of the existing digital public goods that exist, such as Aadhaar or DigiLocker or eSign. So currently, your ABHA for a citizen is actually verified and authenticated using Aadhaar that is already out there in the public domain for everybody to use for accessing various services. That's the identity layer. Then we have the 3 gateway layer that I spoke of earlier, right? So the central bit, the gray box that you're seeing, is the Health Information Exchange Consent Manager. And just for simplicity's sake, just think of these as 3 gateways that exist that NHA has built and made it open to the public. what these gateways allow is really where the beauty of ABDM really lies, right? For the Health Information Exchange Consent Manager, this allows for that exchange of health data, right? So can we make health data sharing possible, uh, uh, collation of my data to maintain longitudinal health history, so on and so forth. So that exchange of data between two hospitals, two doctors, from a citizen to a doctor as well, all of that is possible via this gateway. So a request may be fired up from hospital A to access the data of a citizen that is routed via this gateway. And in the middle, the citizen gets consent saying, shall we share your data? This request has been made, and the citizen can give consent, and their data is shared from hospital B back with hospital A through this gateway. So that is the exchange of data bit. On the left-hand side that you'll see is a unified health interface. For simplicity's sake, you can think of this as the UPI of healthcare, right? So how with UPI you can exchange money, transfer money across, from a Paytm to a Google Pay to a Phone Pay. So that interoperability of services has happened in the fintech sector. So a similar approach has been taken in the health sector as well, saying, can I be on one particular application, whether it could be a Practo, a Tata 1mg, eVital, so on and so forth, and my doctor may be using a different application, right? So how can we make people on two different platforms talk to one another is what UHI will enable. And when people are able to talk to each other across different applications, things like teleconsultation will come into play, discovering labs, discovering pharmacies, booking appointments, bed discoverability as well, right? So all services will then kind of be available to a bigger, larger audience to access and avail through this gateway. And lastly is the health claims exchange bit. Like I mentioned earlier, this is the standardization of the claims process between a hospital and a provider. So it includes the e-claims process is standardized, the policy markup language is standardized, the bill markup language is standardized. And the idea really is to reduce the turnaround time for claims process. Can we have auto verification happen? It will drastically reduce the frauds and things of those nature during the claims process as well. So these are the three gateways that exist as part of the technology architecture of ABDM. And if I come last to the user application, right? These gateways exist as a technological backend that NHA has provided. But how does a citizen, how does a doctor really become a part of this ecosystem, right? So this is where the applications come into play. So for a citizen to be a part of an ecosystem, they may use a PHR application or a personal health record application. So any application that allows them to manage their health data better, share, discover health services better, so on and so forth, is what a citizen uses. For a doctor to become a part of it, they would need their HMIs or the LMIs or any other software that they're using to be integrated with ABDM so that they can carry out the functionalities that are part of the ABDM ecosystem. So I'll just pause here, just for everyone to just consume this slide. I know it's a heavy slide, but this really encapsulates the many possibilities that are there as part of the ABDM ecosystem. So we have the identity, the exchange of health data, exchange of health services, and then standardizing the claims process, right? So hoping that all of this will kind of contribute towards more transparency, better delivery of care, more customized care, and just more efficiency in the healthcare ecosystem. I mean, this is just a quick example, right? How can this really impact a citizen in a wonderful way? Where we've taken an example of you have a woman in her who's 28 years old, who can manage her records on a PHR application, and look at her healthcare journey, right? She is pregnant. She's a beneficiary of the reproductive and child healthcare program. She is also availing services under IDSP. She's going to a government hospital. She has also gotten a COVID vaccine. And then perhaps she's also moving to a private hospital to get a private consultation done as well, right? So And this is a reality that we're all facing, right? We are getting second consultations done very often. We are there are many crores of beneficiaries under each of these government programs. So how do we ensure that the person who's traversing the complexities of a healthcare ecosystem, can maintain their healthcare data at one place, right? I should be the owner of my own healthcare data. I should be able to manage my healthcare data that is coming from various devices, various platforms at one place. That is one. And second is I should also be able to present my identity to each of these service providers as well, saying, here is my Aadhaar number, which says this is my name, this is my demographic details, and that is actually verified and authenticated information of the citizen in the entire healthcare ecosystem. And again, at the bottom, you can see if patient provides consent, this data can also be accessible by their doctors, by their nurses, by their frontline workers, by insurance companies, with the consent of the patient themselves. I'll just quickly run through this. This is, the gateway that I spoke of earlier. So if any health information user, which could be a public program, a doctor, a health locker that wants to get healthcare data from a different hospital, they can usually, raise a request. The request is routed via the consent manager. It goes to the health information provider, which could be a different hospital, which then shares back the data with patient consent. This is UHI, just double clicking on Unified Health Interface. How today, like I mentioned, if you are on application A, your doctor also has to be on the same application for you to be able to talk to one another. But with UHI, what will be possible is you can be on one application, your doctor can be on a different application, and they can speak to one another. And this is all fueled by open protocols, open APIs that NHA has built and supported and is now made available for everyone. Now, these are the 3-4 elements that we spoke of that ABDM fuels. I just want to take a minute and say, we've been live with ABDM for over a year, right? So where are we currently in the ecosystem? So these are just a few numbers to put the adoption into perspective. For example, with over 43 crore citizens today have their ABHA, the Ayushman Bharat Health Account, which means that they have a verified, authenticated identity in the healthcare ecosystem for themselves. And this number is also increasing at a very rapid pace. These numbers have come from many areas, which could be the COVID vaccine, could be various programs, which is a non-communicable disease program, RCH program, and also many private players as well, who have integrated with ABDM, private HMIS players, private personal health record application players, who have also offered their functionality to create ABHA to their users, through which so far 43 crore citizens have created ABHA. Over 2 lakh health facilities today are registered on healthcare facilities registry. 2 lakh healthcare professionals have registered on the HPR. And these are a combination of both public and private healthcare facilities. And similarly for professionals as well, combination of both public and private, and also is across the nature of medicine. So it includes both modern as well as traditional medicine as well. There have been over 23 lakh downloads of the health record application. So as part of the initiative to drive adoption, NHA has also built its own PHR application, which is called the ABHA application. It is available on Android right now, as well as iOS soon. So over 23 lakh citizens have downloaded this app and are actually using this to better manage their health data as well. So if you have an Android device, I would recommend, you may also download this application and see for yourself how you can manage your health data and also pass that information on to your patients. 28 crore health records have been linked. Now, what that means is 28 crore different health records that have been generated have been linked to the ABHA of a citizen, right? And that is how you really are building the longitudinal health history, that my health data is actually being linked to my identity number or my identity address. And that is what enables me to carry forward this data and share it across the ecosystem. We have 1,000+ active participants who are integrating with ABDM. I'll actually move to the next slide to talk about this. So currently the logos, the names that you're seeing on your screen are the various players in the ecosystem who are already part of the ABDM ecosystem. And like I said, we have a diversity of players who are part of the ecosystem. So we have government health programs, We have CoWIN, NCD, NICSHARE, Poshan Abhiyan, RCH, right? And these are programs who have beneficiaries which, which really cover a big landscape in the country, crores of beneficiaries who are already part of the ecosystem. We have government health solutions, which such as eSanjeevani, eHospital, eShushrut, Arogya Setu, DigiLocker, even some state-specific HMISs, of West Bengal, Tamil Nadu, Andhra Pradesh. All of these state-specific HMISs have also integrated with ABDM. And then we have private players. So and this is again a combination of HMISs, LMISs, health lockers, personal health record applications, labs, diagnostics, etc. So you can see a couple of names here, some leading market players, right? We have Practo, PTM, Briefcase, SRL, Narayan Health, Plus91. All of these health tech players are already part of the ABDM ecosystem, and people were engaging with on a daily basis to drive its adoption forward. I also just want to share this, and Vikram sir alluded to this earlier, that while these are all great benefits to have in the long term, can we actually demonstrate a short-term benefit, immediate benefit to solve for the patients? And we actually designed a use case which we call scan and share. It's been in the news very often recently, so you may have actually come across this, where we often notice in these public big hospitals, the queues are very long, are very time consuming, and frankly very distressing for the patient to stand in, and then for the hospital to manage as well. So what was built was that, can we enable the citizen, to really empower the citizen to share their health, to share the demographic details with the hospital digitally, and they get their token number for registration on their mobile application, right? So if it's for a citizen who has an Aadhaar number that is generated, they would take a personal health record application, and this could be any application, could be Briefcase, Practo, Paytm, etc. And they use this application, and there's a QR code, that's placed in the hospital, and everyone's now familiar with using QR codes. So they go scan, and they give consent, and their demographic details are shared with the hospital's HMIs. And in return, they get a token number for their OPD registration. And then there is a screen display that is there in the waiting area. So as in when I know, okay, my token number is 10. So whenever token number 10 goes, I go to the counter, and then I'm assigned the department that I'm supposed to go for. So this has really brought down the registration time almost from 50 minutes to an hour to like about 3 to 5 minutes for a patient, right? So in cumulatively, if you notice, there's been a lot of saving of time for patients and the facilities, and also just, I think, enhancing the patient experience when they're going to go avail healthcare service. Now, this is just one of the many use cases, and NH is already in the process of widening the scope of these use cases and solving for other challenges that are also a citizen faces while they're in the hospital. But happy to share that as of we have over 50,000 tokens that are being generated. So that means 50,000 users are actively using this functionality with their mobile phone to just scan and get the OPD registration done under 5 minutes. So that is the ABDM bit, and now I actually want to share saying what can you do to be a part of the ABDM ecosystem. And this really is a call to action to everybody who wants to join the ABDM ecosystem. Is that if you are part of a hospital, if you're a physician, if you're a physician, would definitely recommend, encourage to please go check out the healthcare professionals registry and get yourself onto the HPR database. And if you have a hospital, clinic of any kind, get that registered on the healthcare facilities registry as well. I'll be happy to share the links on the chat shortly, so you can directly go and check that out for yourself. But if you are an HMIS LMIS provider, or if you're a doctor who has an HMIS LMIS, would encourage you to go get your solution registered on the ABDM sandbox to actually integrate with ABDM. ABDM sandbox is actually nothing but a testing environment. It's a technological testing environment for any application to just test out the functionalities of a particular platform or a scheme that is running properly in, to actually take that to the live production environment. So NHA has set up an ABDM sandbox. So any solution or a program can go register themselves on the sandbox. There is a short form that you have to fill. Once that is approved, there's a testing process that happens. You get access to APIs that are published by NHA in the public domain. You consume those APIs in your software, in your system, and then you exit the sandbox. And then you become part of the ABDM ecosystem, and you start carrying out the ABDM functionalities that are possible. This is just a deep dive on what the process looks like. Like I mentioned, you can go register on the ABDM sandbox. It's a short form. Once there's an approval that is to be given by NHA, which is just a process that happens within 24 hours to 48 hours, you get an approval on the sandbox, and then you get access to APIs that are published by NHA, which the solution will then have to integrate. And there's very comprehensive, detailed documentation that is available. So, it's not a very challenging task in that sense to understand the entire workflows that need to be incorporated for the solution provider. Once that is done, there's a functional and a non-functional testing that is usually done. Once that is done, there is a security testing that has to be carried out. And certifications are required just to ensure that your application, which is integrating, is safe to host. And post that, another final demo is given to NHA, where a committee sits to give a final approval. And once that is done, you exit the sandbox and then you go live in production, and then you are part of the ABDM ecosystem, which means that you can actually create Aadhaar numbers for your beneficiary. You can facilitate exchange of health data for your citizens and patients, and then you can also pull health data. You can pull health data as well to see data of your longitudinal health history of your patients and so on and so forth. So that's just a very...
Sorry for interrupting. We have almost 10 minutes about time. So if we could get into the question answers quickly, if possible.
That I will. Actually, this is pretty much this thing.
Thank you.
These are the last 2 slides that I have, that I just want to say that NHA has also put down a lot of support mechanisms for everyone to come onto ABDM. We constantly are doing many workshops, awareness activities, so social media campaigns, so on and so forth, to drive awareness among citizens as well as doctors and health tech players. Like I said, we have a pretty seamless integration process on the ABDM sandbox. I'm so sorry. We have use cases such as scan and share that are already live in hundreds of hospitals in the country. We have microsites, which is essentially a great opportunity for hospitals and HMIs and LMIs players to actually become part of ABDM. There's been budgets allocated for this, and NHS has put out guidelines for this as well. This is again in the public domain, so would encourage you to read up on this as well to demonstrate ABDM usability in a specific in a small geography. And lastly, which I think may interest everybody here, is there's also an incentive scheme. So if you are linking X number of records, if you're doing ABDM transaction, there's a financial reward that NHA provides to the hospital, to the solution that is being used in the hospital, to the PHR application as well. So far, I'm sure Vikram sir can also attest to this. We've been dispersing funds every month on a monthly basis to all players who are actively contributing the ABDM ecosystem. So make this a really financially viable and sustainable, and encourage people to join the ecosystem as well. Again, details of the exact monetary benefits, etc., is available on the website. Right, and with this, this is my last slide. These are the links. So I would encourage you to go to the www.abdm.gov.in to read up more about ABDM, and also the Sandbox website as well. And all the information you'll require will be there as well. So I will stop here. My apologies